I'm Dr. Mario Guthrie and I'm a general practitioner. Smoke inhalation is very significant in that it can affect the body in many different ways. Smoke and fires use a lot of oxygen, and we need oxygen to breathe. So in removing oxygen, that's one of the ways that it can affect you. And also smoke generates a lot of carbon monoxide. Carbon monoxide is a dangerous substance that can be formed and can bind with what carries oxygen in our blood, which is the hemoglobin. It is the most common cause of death from smoke inhalation. So carbon monoxide poisoning is also very significant. Of importance, smoke in burning things will generate a lot of irritants and particles that can affect the eyes and other soft membranes of the body, the skin, and also go into the lungs and go into the body as well and cause damage that way to different organs. Which brings me to the fact that smoke inhalation may not affect you immediately. It can have immediate effects and it can have delayed effects up to days and even long-term effects down the line, months and years in some cases. As you can imagine, of course, how long you're exposed to the smoke and the type of things that are in the environment that are being burnt will determine how badly you're affected. So if you can get out of the smoke quicker, of course that would be better for you. And of course, depending on what is being burnt, that will determine the effect that it may have on you. So the answer is yes, being exposed to more smoke and inhaling more smoke is more detrimental to the body than less. The effects of smoke inhalation, some of them are, as I said, immediate, they may be long term. So technically I would say that some are irreversible. It depends on how badly you're affected. If down the line you develop lung cancer, maybe that may be potentially treatable. But in the immediate aspect, you want to give someone oxygen, so you may recover. But in some cases, no, some of the effects are immediate, burns, and some damage may be permanent. Symptoms of smoke inhalation of importance include cough, shortness of breath. You may develop headache. Of course, it can affect the eyes, so you can have redness in the eyes, tearing, burning in the eyes. The vocal cords can also be affected, so you can get hoarseness and also noisy breathing, which is important. Down the line, you may develop other symptoms. So it's important to really be aware of your breathing and of your respiration, which will be affected most commonly. Also, because of the heat from fire, you can have singeing of your nasal hairs, you can have swollen nasal passages, and these are things that can happen more immediately. Well, in my professional experience, I've worked a lot at the Children's Hospital, and what I have seen a lot are children who are exposed to burns. And some of the burns are small burns which can be sent home, and some of them are very severe, affecting the face and joints and areas that require admission and skin grafting. And a lot of the reasons that this happens is because people do a lot of illegal burning and illicit burning in their yards and in their houses, and the children unfortunately become victim to these activities. So it's very hurtful to see, but we always encourage the parents to try and not burn and do any illicit burning or keep any chemicals in the house that may affect the children.